Hello everybody, I'm back. If you're watching my video, please don't forget to like and share this video and subscribe to my channel. If you don't mind, I'm going to be documenting my journey with breast cancer. So my name is Sean. My channel, I'm Miss Love. And the last video I posted, I talked about, going to get my mammogram and the mammogram coming up normal. And then they called me back to get another mammogram, which also, at this time, the second mammogram, they just focused only on the one breast. And then that was abnormal too at that time. After that mammogram, I talked to the doctor, and he said that, we have to do a biopsy. Did the biopsy. I want to say it was February the 28th? No, or March 1st. It was like the 28th. I think it was the 28th, if that was a Friday. And so I kind of uploaded, my videos are uploaded a little late because I had to process the whole news, okay? So I could say, let me cover my last name here. Well, I'm not going to show that right now. But, so March the 4th, I get we had this thing called My Chart, and I know a lot of people are familiar with My Chart. I had dropped my daughter off to get her nails done, because we kind of do, when we both off, we do little outings together. I didn't want to sit in the nail shop with her, so I decided to, drop her off and go to the thrift store. But on my way back, I get the notification to my phone that my results were in. And when I looked at it, I kept scrolling down and I was driving, I pulled over, and I'm scrolling down to find benign somewhere, and it wasn't. So immediately, when you get that news, you don't know what to think, you don't know, how to feel. My cousin who lives in Washington, she's a nurse, so I called her. And she was like, do you want me to tell you what it means? And I said no, because, a lot of times you just don't want to hear. I was so anxious and so nervous, and so many things was going through my head. So then I emailed my doctor, because, when you get those test results, the patient gets it a lot of times before the doctor do, when you log on to My Chart. So my doctor, she is so amazing. She called me right back. And, I was like, please explain to me. And she said, I'm so sorry. But she was like, you're healthy. You got this. It's small. And I'm going to connect you to the right people over at the breast cancer center. So she did. Within about an hour, the oncology nurse was calling me to set up all my appointments. At that time, they told me I had ductal carcinoma in situ. It's called DCIS. But it was more tests to be ran. So that Tuesday, which was the 4th, is when I got the news, right? I mean, I broke down, my daughter crying, my son, he didn't want to, he's so, I don't want to put this, like, if it's something that he don't want to hear, he don't want to accept it, he'll try to make it to be something else, and I just had to tell him, listen, I have cancer. And at that time, I didn't know where I stood with the cancer, what stage the cancer was. I do know that the nurse that was doing my mammogram and stuff, she was like, you know, if it comes back cancer, it's small. Okay, so I did know that. And my doctor had told me on the phone that it was small. So I'm still in shock, you guys. If you have a loved one that gets that type of news, just know that emotionally, it affects them so bad. All I can think about is my kids and my grandkids. And what does this mean for my future? You know what I mean? I kind of battled with depression from time to time. So I immediately found myself wanting to go back to that dark place, you know? And it really messes with you. It does. You just have such an array of emotion. I couldn't stop crying. So I called my boss and I told her, you know, I work with at a psychiatric hospital. And I said, I can't interact with the patients right now. I can't be on the floor. So I was put to desk work secretary. So that Wednesday I go to work. Excuse me. When I was on break, I get a call from the nurse. And she says, you know that other test that we were waiting on? Now, at this time, they had set me up with an appointment to see the whole team. The oncologist that deals with chemotherapy, the surgeon that will remove the cancer surgically, and the radiologist dealing with radiation. So when she called me, and I was on my break, I was sitting in my car, and she says, you know, that other test we were waiting on, it came back that you have a triple negative as well. And she said with that can sometimes be aggressive, and they like to start those patients with chemotherapy first. You guys, I can't tell you at that moment that she told me that. I was trying to keep myself together. And she said, I'm going to switch your appointment. She said, you can keep that regular appointment, but if they want to start you with chemotherapy, we need to get that started immediately. So she ended up setting me up to see Dr. Khan that Tuesday. And I'll upload another video too, and I'll put in a conversation because my daughter recorded the conversation that Dr. Khan had with me. So she set me up. Right now I'm just telling you what's leading up to my appointment. So at that time, my whole body just tensed up. Previously I had shingles like on this side of my back. I could feel it again flaring up because of my nerves. The nerves, you know, that sensitivity. If anybody's ever had shingles, it burns, the sensitivity and stuff. It just started to just rear its ugly head again. And it's calmed down now, but anyway, I couldn't stop shaking. My nurse manager came out and she consoled me. The nurse Chad, he came out and consoled me. And I just, you know, I could have went home, but I was like, I can't go home right now. I just stay at work and deal with it. I didn't tell my kids either. And so I end up telling them, you know, they moved my appointment up because I might have to start chemotherapy first. And I didn't tell them why. So with that news, I need people to understand when you get that type of diagnosis, any kind of cancer diagnosis, if you have a loved one, please be supportive. Please be encouraging. Please be understanding. Reach out to them. I know sometimes it's hard to find the words to say to people, but just let them know that, you're in my thoughts, you're in my prayers, I'm thinking about you. I've had so many people, my work family, y'all, I'm trying not to cry. That's why I keep pulling myself back in, reeling myself back in. My work family, my family, my brother and my nephew, they flew in from Atlanta to be supportive of me. My brother here, my mom, my children, just, some of my cousins and my nieces, and, they just was there for me, and I just appreciated having that support. You know what I mean? And at the same time, you get this news. I have an auntie. My mom, it was 15 of them. Well, 14. The last one was a stillborn. 14 of them. And my mom and my auntie are the babies. My mom is the baby. My auntie is next to her. And they're the only two left. And my auntie is battling cancer. I was just in the hospital taking care of her. She had this whole side of her face reconstructed, some of her lip taken out. She had mouth cancer, skin, and then she had a trach put in, a feeding tube and all that. She's doing amazing right now. She's going through radiation. She's able to speak again. And I'm so thankful to God. But at the time, I didn't even know that on the inside I had cancer. You don't know. It's very sneaky. I had no symptoms. My breast still don't hurt. I didn't have no breast hurting, no leaking, no lumps, no nothing. Do you hear me? Nothing. Last year, I go get my mammogram, normal. This year, I go get my mammogram, I have cancer. So that's how important it is for you to go and get your yearly checkups. Get your blood work. If you have numbers that don't look right in your blood work, tell them, do research on your own, what these numbers can mean. Talk to your doctor. Explain to me. If you can't explain to me, because some doctors, if you go to a family practice doctor, sometimes they don't understand certain things about certain blood work that's drawn, because that's not their specialty. My doctor was straight up with me, I'm going to send you to the people that know what they're doing. These people specialize in breast cancer. Dr. Khan specialized in chemotherapy, treating and killing cancer. Dr. Larson specialized in surgically removing cancer. And I can't think of another doctor. Let's see. I'm going to cover up my last name. They send you this. They so amazing. They send you a whole booklet with your name on it, personally for you, with all your appointments in there, resources, the doctors you're going to see. This is not Dr. Larson, I don't think. No. So, they send a personalized, I don't know if you can see, letter just specifically to me. And they educate you on all the doctors. This here is my oncologist, Dr. Khan. And though I haven't seen him or her, I have seen the surgeon, Dr. Larson, who specializes in surgically removing. So they tell you what to expect when you go to your appointments. And it just helps take your mind off of, I don't have my surgery date yet. But yeah, they give you a list of your appointments. And these appointments are different. So initially, okay, I did have a consultation with Jamie and Dr. Khan, and then Dr. John. I haven't met him yet. I think he specializes in the radiology. When I start radiation, then I guess I'll see him. But you guys, the sun, is it going out? Let me see. Make sure this music is down. I'm about to hold it because the car not started. So, but student work. It's a cloudy day today, you guys. So I just want to let you guys know, please be supportive. I got my notes, what's notes? So it's some things that I need to write down. I'm going to upload a video explaining to you about my visit with Dr. Khan, the oncologist that talked to me about chemotherapy, what stage I'm in, and the treatment moving forward. Then I'll upload a video of me and the surgeon, visiting the surgeon, what the plan is for surgery. Right now on Tuesday, I go get my MRI, because they do an MRI to make sure that the tumor is what they saw on the mammogram, the location. Then they'll schedule my surgery. I have been diagnosed with micro-invasive ductal carcinoma in situ. It's called DCIS. And the reason why it's now micro-invasive, so ductal carcinoma stays in the breast, from my understanding. But because I'm a triple negative, it's a cell that likes to travel. And we'll talk more about that in the next video. But my main point is in documenting my journey and my walk is to encourage people. It's a young lady that I follow on YouTube named Batty Red. I think that's her name. And I saw her video. It broke my heart because she was crying and she was frustrated. Because you do get frustrated. You do feel like, when I see how her progress is coming along, I'm thankful that how fast the doctors move on my behalf. And I'm thinking, like, y'all dragging y'all feet. Because you want it boom, boom, boom. No, I need to be in surgery tomorrow. I need to start my chemo today. You know what I mean? And radiation the day after surgery. So that's how you want it, but that's not how it is. So it is moving pretty fast. I got diagnosed on March 4th, and I've already seen my oncologist. I've already seen the surgeon. I've already getting ready to have my MRI and then surgery. So I'll probably have surgery sometime in the next few weeks. After surgery, I don't know when I'll start my radiation. But yeah, at this point, I don't know whether or not I'm going to have to do chemotherapy. Yeah, I'm slouching down in this seat. Said I'm going to show my name, but anyway. But yeah, that's my story. This is now a detour in my life that I have to take. And who likes a detour, right? You driving along and you expecting to go on a specific path, and there's a detour. It doesn't mean that you're not going to reach your destination, and it just means that you have to go a different route. And now I'm on a different route. And so, yeah, I'm on a different route. The Lord had to remind me that, you know, I'm His, and He is my healer. He is my protector. He is my source. Like, He had to reel me back in. Why do you get so caught up in what the flesh wants to think when you need to be led by the Spirit? This is what He's telling me. And I'm like, Lord, okay. I had to take a deep breath. And like before, years ago, when I had to ask Him to help me to forgive, I had to ask Him to help me to accept and go to Scripture. And James says, all things work for the good of those that love the Lord and are called according to His purpose. So I have to stand on His word, and I have to know that He has my back. He has me. He is my healer. I am healed. And prayerfully, my testimony, my walk will help another young lady. That young lady that don't want to go get the mammogram and go and get caught in time. There's so many women like that I have shared with that I have breast cancer now that haven't had a mammogram in a few years. Women, our body goes through, when we hit 40 and the late 30s and the 40, and we hit 40, our body goes through a lot of hormonal changes that can affect us in this way. That's why it's so important to go get your mammograms, and make sure you get a 3D mammogram. Make sure you get a 3D mammogram. And I've said this in the last video. Make sure you know your family history. My grandmother, my father's mother, had breast cancer. I have a first cousin on my mother's side that had breast cancer 20 years ago in the left breast, and 20 years later it came in the right breast. Thank God it was caught early, because she would have got her mammograms and this and that, and it was caught early. And she just got done with radiation. My auntie's currently in radiation, and I will be in radiation. So I can't stress enough. Go get your checkups, please. That is so
New text
important.
message from My Princess.
My daughter texted me. Go get your mammograms. Okay, I had to pause it because my daughter. And I can't stress it enough.
New text message from My Princess.
I'm sorry, you guys. It's coming through my thing. Goodness. I apologize for that. So, go get your mammograms. Go get your routine blood work. Get your checkup. Men, go get your prostate checked. Men and women, go get your colonoscopies. These things are so important. You don't understand how early detection is so important, you guys. I'm trying not to cry. You don't understand how early detection is so important. It can save your life. It can have you around for your grandkids, your kids, your husbands, your wife. You just don't understand how important it is for you to put yourself first. Your health. Go get your checkups. Go get them. If you don't have insurance, guess what? Go to the clinics. But get your checkups. When I turned 50, I got my colonoscopy. I've been getting my mammograms every year. I don't miss a beat. And thank God I didn't. Thank God I didn't. So, do that. I did also get the test to make sure I didn't carry the gene for breast cancer. And it was negative. Thank God. Because then now I don't have to worry about my daughter and my granddaughter and my nieces. But you guys, I will catch you on the next one. I see, I do smack a lot when I talk. And I do have food here to eat. But I did eat it because I didn't want to be smacking while I was talking. I got some fish. So, I decided to come to my car because my dogs and my grandkids will be interrupting every time you turn around. So, unless I'm at home by myself, I will come to my car. And I got my tea. My cup. My ex-husband sent me this. We still good friends. It's Tahobi or something. Tahibi or something. Tahibo tea or something like that, y'all. It's supposed to be good for you. It's anti-inflammatory, anti-cancer, anti-this, anti-that. He sent it to me. And he's always trying to tell me how to eat and stuff like that. It gets on my nerves sometimes, but I know he cares, so I just don't. I try not to get too irritated by it. And then my kids, my daughter, my son. My son ain't too bad. My daughter, she's like the food police. You can't have this, you can't have that, you can't do this, you can't do that. Don't let that, blah, blah, blah. My son, he don't do all that. He's supportive, though. He's very encouraging. He's my warrior. And sometimes I get worried about him because he'll stress in silence. So sometimes I get worried about him. But yeah. But just know today, I'm feeling better. I'm doing better. I'm encouraged. And I love God. Ooh, these are some beautiful dogs walking. I wish you guys could see them. It's a husky and two little ones. Oh, so cute. Anywho, yeah. So yeah, you can see through the camera she's walking her dogs. But in the meantime, and in between time, have an amazing day. And go get your checkup. Don't forget to like, comment, share, and subscribe. And be ready for my next video. I think I'll do this as part 2 since the first one was. Oh, I won't do that part stuff. It's too TikTok-y. I'll just do, I might even upload this to TikTok. I'll just put my diagnosis. Bye.